And my name's Jennifer.
We're technicians here at Mount Laurel Animal Hospital.
With the help of our friend Magnus, we're going to talk today about instilling drops and ointment onto a dog's eye. Before we go over that, we're going to talk about how to position your dog. The first thing you want to do is make sure your dog is comfortable. If it's a smaller dog, you can put it on a heightened surface on top of a towel or a blanket or something like that. The larger kids, we have them on the floor, either standing or sitting or even lying down, whatever makes them comfortable, because it's about their comfort and their safety and ours as well. You can pet them, scratch them, make sure the environment is conducive to relaxation. For the drops, what I'm going to do is take my dominant hand and rest the palm of my dominant hand on his head. Take my other hand and cup it under his muzzle. I'm going to take my pinky or my middle finger and draw his upper lid back. You can gently pull the lower lid, but if they are flinching a lot, you might want to just stay with the upper lid. Squeeze the bottle.
She's applying just a little bit of pressure because we don't want too many drops to come out at once.
And that was one drop.
Well done, Magnus. Yay, good boy. So depending on what your patient's ailment is or your pet's ailment is, they may send them home on ophthalmic drops. Sometimes they'll send them home on ophthalmic ointments. These medications are petroleum based, and if you think of it kind of like a tube of toothpaste, as soon as I took the cap off, it starts to ooze out a little bit, and whatever oozes out, it won't be able to go back in, so you want to use it sparingly. We only need a 1/4 inch strip or ribbon, or about the size of a grain of rice. And the positioning for doing drops and ointments is pretty much the same. You're just going to use one hand, preferably your non-dominant hand, just to hold his head steady. Again, making sure that you're being very patient with your pet, because eye drops are not always the most fun. Just give them a chance to settle down, see how they'd like to sit still for their drops. And I'm going to use my pinky just to gently pull back on the upper lid. It's an ointment, so it still is going to cover the entire surface of the eye. We just need to make sure that we don't touch the metal tip. It can scratch the cornea, which is uncomfortable, and or it can contaminate the rest of the tube. So now that I have my little strip started, we smell something good. We're going to gently lift back the lid and just a small amount of the ointment. And then using your fingers just to massage the lids very, very gently, and it helps to evenly disperse the ointment. That's it.
Thank you.
Good job, Magnus.